Hi, I'm Dr. Jason Young from Body Health Chiropractic and Wellness Center. One of the interesting things that you find when you're a chiropractor is that sometimes you will see a streak of the same type of injury over and over and over. Maybe the same type of low back injury or rib injury or whatever. This week for me, it's been a lot of people coming in with limited range of motion in their neck. Um, a lot of times it'll happen like this. They'll wake up in the morning and they try and get up and they find that their neck is stiff. I had one young man who came in and his neck was stuck just like this. And so everywhere he went, he had to look like that. I've had people who have come in and maybe they only had 20 to 30 degrees of range of motion in their neck in rotation, whereas the average person can do about 80 degrees. So this is about 80 degrees, and maybe they could go this far or this far, or leaning their head from side to side was very limited. And what we find is that whenever people come in and they get this treated early, they don't let this go on for days or weeks, is that pretty quickly we can restore a lot of that range of motion. For example, I had somebody who came in the other day who, when she started, had about 36 degrees of left rotation, and by the time she left, she had a full 80. And it's about 10-15 minutes worth of work, and it was very comfortable, wasn't painful for her at all, and we were able to just really get some really good instant results. And so chiropractic is absolutely a great way to deal with a problem like that. And there's a couple other reasons that you want to get that checked out. One of the other ones is that it could be something serious, especially if you have been feeling under the weather, like if you've had a recent fever or something like that, and then the neck stiffness sets in, then you definitely want to get checked out and make sure that it's not something more serious like maybe meningitis, which is potentially deadly. And so that's one of the reasons it's good to go see a chiropractor and get checked out, is because we're trained to look for what is kind of more of a normal stiff neck type of situation, as opposed to something that might be really dangerous, and make sure that you get the help that you need. Um, so let's talk about how this happens, especially this phenomenon where people wake and they're having symptoms in the neck suddenly. People will tell me something like, I slept on my neck weird, which always kind of drums up an interesting picture for me of somebody like actually kind of sleeping straight up and down on their neck. But I know what they mean, which is just that the head is cocked in a strange position. And a lot of that has to do with the type of pillow that you use or the position that you sleep in. For example, if you are a side sleeper, okay, then you need a pillow that's going to fill up the space in between this joint right here, which is your acromioclavicular joint, and the side of your head. And when you go to sleep, if this is my bed right here, my head should just be slightly like that, because overnight my head is going to kind of compress that pillow some and bring me into neutral. Where people get into problems is when they have a whole bunch of thick pillow, and so they're jammed like this all night, or they have a really thin pillow, and so then they're stuck like this all night. And what happens is it actually sprains your neck. The ligaments that surround the joints there in your neck, overnight, they will tend to get stretched out. It's kind of like stretching a rubber band, and when you hold it stretched for a long time, and then you let go, it doesn't go back to that original length. And so technically, that's a sprain. It doesn't happen in the traditional way that you think of, like maybe you step off a curb, or you come down on somebody's foot whenever you're rebounding in basketball, and you snap a ligament like that. Probably the more common way that people get sprains or strains is by prolonged postural stress, where tissues are being stretched out over a long period of time. So that's what can happen with a pillow. If you're a stomach sleeper, you're also at great risk for this, because if I'm laying face down on a mattress and I don't turn my head all the way one way or all the way the other, I'm going to die. And so if you're a stomach sleeper and you're trying to avoid death, your head is going to be cocked all the way in one position or another the whole night, and it just leaves you at risk for a neck sprain or strain. Excuse me. One of the reasons that it's really important to get this sorted out quickly, or to seek some sort of treatment, is that a decrease in range of motion in a joint is probably one of the most telling indicators of whether you will have problems with that area in the long term. So a great example is maybe somebody who's been in a car accident and gotten a neck sprain or strain that way. Then they come in and we find that as a result of that trauma, they have decreased range of motion. Well, that for me sends up a bit of a red flag, because if that person doesn't receive treatment, research has shown that down the road that they might be more prone to having chronic problems like never getting that range of motion back, headaches, neck pain, and other difficulties. And so anytime you have decreased range of motion, especially in an important area like your neck, that should be checked out and it should be treated. I'm going to show you 2 exercises that I recommend to just about everybody who comes in with some sort of a neck sprain. There's a lot of good research behind these 2 methods, and you know, whether you get adjusted or not, these are things I always recommend to people who have some sort of a neck injury. The first one is pain-free range of motion. So range of motion, when I say that, what I'm talking about is just how your neck moves. And so there's a few principal movements that we're looking at. One of them is to turn your head all the way to the side. Okay, so that's rotation, looking up and down, and putting your ear towards your shoulder, other ear towards the other shoulder, pushing your chin forward like a turtle, and pulling it back, making double chins. So going through those different movements, that's your range of motion in the neck. And so when I say pain-free, I'm talking about avoiding any sort of like sharp or reproducing the pain that you get with rotation. So, or any sort of movement, not just rotation. So, for example, if I can turn my head all the way like this, but I turn this far and this gives me pain, this is where I stop. And so you get to that threshold of pain, back off of it a little bit and hold there for a few seconds, and then go the other direction and the same type of thing. And going back and forth, you know, maybe 3 to 5 times. And then same with up and down and ear to shoulder, always avoiding pain in every direction. What you'll notice is you do this consistently. By consistently, I usually recommend to patients that they do it once every waking hour. So that means by waking hour, I mean you don't have to wake up in the middle of the night to do your range of motion exercises. That would actually be terrible. But doing this consistently does a few things. Number one, it stops any further loss of range of motion. Number two, it starts to give you back some of that lost range of motion. Number three, it promotes blood flow to the muscles that might be spasming or hurting, and it also helps you to feel more comfortable as well. The other important exercise is called isometric contractions. Isometric is kind of made up of 2 parts, the word at least. Iso means same, metric means length. And so we're contracting a muscle, but we're keeping it at the same length the whole time. So, for example, if I put my hands on my head and then I try and rotate my head, I'm not getting much of a change in the length of my muscle, but I can feel that all the muscles in my neck that do rotation are contracted. And so turning this way, holding for a while, and then trying the other direction, holding for a while. The purpose is not to try and overpower my hands. I can already guarantee you that your hands are stronger than your neck muscles. But doing this full contraction allows you to get back some of the voluntary control from the muscles that may be spasming and contracting involuntarily. You can do this in every direction too, so pushing back and pushing forward, pushing to the side, and pushing towards the side. I suggest that people do this with their pain-free range of motion exercise, and those 2 exercises do a lot towards getting people out of pain. So if you have acute pain and you're waiting to get in to see the chiropractor, get started with those exercises right away, and it'll give you some help. Any sort of movements that send pain zinging down extremities or create numbness or tingling or weakness, you should avoid until you can get checked out by a professional. But otherwise, hopefully, this has been really good, useful information for you. These types of issues, like I mentioned, we have a lot of success with that are quick and easy, and you deserve to be comfortable and be able to get on with your normal life. So share this video with a friend, like it, leave comments and questions, and I'll be happy to answer. That's all for now. I'm Dr. Jason Young from Body Health Chiropractic and Wellness Center.